I'm going to talk about what you do in the hospital. 3 things. Number 1.
Walk. Breathe.
Walk. Okay? We want you to walk, walk, walk. Why are we walking?
That's good.
No! You pass gas at home. Don't be passing gas in the hospital. Why are we walking?
Helps the healing process.
No. I heard it.
Blood clots.
Prevent blood clots. Where are the blood clots?
Legs.
Calves. Okay? It's usually where they start, your lower legs. Now watch me now. I said calves. Some of y'all still walk like this. Is that using much of your calves?
No.
Shuffling your feet like an old person. Is that using your calves? No.
Heel toe.
Okay? So you really want to walk real tall and really try to step. And if you have, you know, the assistant up there or the nurse, or you can hold on to the nurse's station desk, or, you know, there are bars around the walls, just hold on to it. And if you can, if you don't have bad knees or anything like that, you can just raise up on your little toe lifts. Pump your calves a little bit. Does that make sense? Because what's the problem with the blood clot in your calves?
Travels to your lungs.
To your lungs. That's called a PE, pulmonary embolism, right? That's why we would want to prevent that. So right after surgery, we get you out of bed in 4 hours. So when the nurses get there and say, hey, time to walk, hey, what are you going to tell them?
Okay.
I'm ready. Okay? And sometimes you're too groggy, and they'll judge you. If they're like, whoa, you're too groggy, go ahead and get back in bed, that's okay. Or we're just going to walk to the chair or walk back. But if you're wide awake, who was wide awake right after surgery?
Not right after. It took me like 7
Yeah.
hours.
Some people, like, you didn't even look like you had surgery. Juliet was just like ready to go play some golf or something. She was ready. Some people are just wide awake. You just never know. Okay? The next thing you're going to do is sip. Sip, sip, sip. Now, we keep your mouth dry that first day, and we don't even let you brush your teeth. Some people are like, why can't I brush my teeth? And the answer to that is because you're coming out of anesthesia, you might forget you just had a sleeve, and you might be brushing your teeth, rinse your mouth, and then swallow the water. Now, would Dr. Vong make that shit up? No. Or has that happened to somebody?
Wow.
So that's happened. They didn't mean anything by it, but they were just like, oh. And I'm like, oh boy, it'll be all right. Don't panic. It'll be all right. But so because I can't really judge how alert you're gonna be, I just say, just don't do it, right? Or wait for me to see you that evening, and I can tell how awake you are. But usually the next day they'll bring you ice chips, right? We start at ice chips on the next day, and then you start sipping water at noon. From there on, you gotta sip, 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 sip. Is that true?
Mm-hmm.
Sip, 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 sip. So all time long you're gonna be sipping, 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 sipping. Is that right? Now question, once you recover from surgery, you're 1 month out, 2 months out, 3 months out, 6 months out, 2 years out. Do you still need to keep sipping?
Yes.
Yes. In fact, one of the things I'm going to start telling you guys more is this. You need to start thinking of yourself as a hydration machine, not an eating machine. Your goal is to hydrate. When you wake up in the morning, you need to say, my goal is to hydrate, not to eat. And I'll talk about that here in a second. Okay? So the third thing you're going to do is what? Breathe. So we help you breathe. What happens is when you have surgery, any surgery, your lungs, we put a breathing tube down your throat and breathe for you. Your lung has these little air pockets called alveoli. And they have a tendency when you lie in bed to collapse down. So these are little air sacs that collapse. And that condition, when the air sacs collapse down and you have a portion of your lungs that don't work right, that's called atelectasis. guys are making me work hard today. Atelectasis. I promise you I'm a doctor. So it's called like a plate-like condition. These these air sacs don't want to open up. So your job is to open up the air sacs. And the only way to do that is to really use this breathing thing right here. Really suck down hard, okay? So we're gonna practice here in a little bit. I'm feeling kind of bad because there's a bunch of little kids in the room. All right.
She's not a kid.
So this machine is called the incentive spirometer, okay? And its job is to open up your air sacs, okay? Now, the first thing you're gonna do is you have to remember that your job is to suck on this, not to blow. Because some people are gonna get this on the day after surgery and they'll be like, trying to blow, and it doesn't work. The other thing is the respiratory therapist will say something like, see there's a little bar right here, it says the best area right there, and there's like, just try to hover it in that area, and you're just like, and you're trying to hold that. Don't listen to them. Listen to me. Your job is to suck on that really hard. Pull that thing real hard as you can. Pull it up hard like it's your honeymoon, you know what I mean? Like really make him proud, right? So the reason why is because with your obesity, you have this extra weight on your chest wall. It's harder for you to expand, right? And you're gonna have to pop open. Now listen to what I'm just saying. Pop open these collapsed air sacs. So we'll pop and open these collapsed air sacs. Does that sound painful?
No.
Yeah. Does that sound painful? Yes. So is it gonna hurt? Yeah, it's gonna hurt, right? Are you gonna cough up a bunch of sputum and junk in your lungs? Yes. Right? Is that a good thing? You wanna cough that stuff up? Yes, you do. Do you wanna swallow it? No, that's gross, man. Like throw up in a bar. Spit it out. Okay. But you wanna suck. So what we're gonna do is we're gonna practice real quick, all of y'all. Okay? So you're gonna make a fist. Go, hold up your fist. And when you have surgery and you're under anesthesia, you're a little bit groggy. And when your lungs are collapsed down, it's almost like you're breathing underwater. So we're gonna simulate how this is gonna feel, right? So you're gonna put your fist up to your mouth, like real tight. You're gonna exhale, and then you're gonna suck in really hard. Okay, ready? 1, 2, 3, suck in. Go, suck. Suck in really hard. And are you sucking? Okay, all right, stop. There you go. I like that. I like it. Now, for those of you who have already had surgery, is that what it felt like when right after surgery? Yes? Yes. Yes. Is that right? Okay. Let's do it one more time. Ready? Make a fist. Put it up to your mouth. Exhale, and then inhale real hard. Ready? 1, 2, 3. Suck, 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 suck. Come on, suck. Suck like it's your honeymoon. Come on now. Go. Make it proud. Right? I almost swallowed my gum. Put out that gum. All right?
Suck.
You gotta suck. Okay? Because some of y'all gonna be like, trying to blow. Like, no, it's not a trumpet. It's not a trumpet. You gotta suck. All right? Now, if you're coughing after you're sucking, are you doing it right? Yes. Yes. You're either doing it right or you need to change your bong water. Dude, change that bong water. No, you're good. Y'all got this? Now listen, when you go home, do you stop doing this? No. You got to keep doing it. Is that true? Because you're gonna want to lay. Are you gonna be tired after surgery? Yes. You're gonna want to lay back and relax and sleep?
Yes.
Yes. Are your lungs gonna collapse again? Yes. Yes. Are you gonna need to open them back up again? Yes. Yes. Is it true after a sleeve surgery? Yes. Or any weight loss surgery? Yes. Yes. Is it true after gallbladder surgery? Yes. Is it true after plastic surgery? Yes. So everything we talked about here applies to any surgery where they have general anesthesia. Does that make sense? Yes? Yes. Okay. Let me ask you this question. All right. How long can we go without food for?
2 weeks.
If you had to stop eating, how long would you go without food for?
A week.
20
No.
days.
No.
Doesn't it depend?
No. About 6 to 8 weeks.
Oh my God. Wow.
People have done food strikes, hunger strikes for 6 to 8 weeks. Now it depends on how much reserve you got. I'm obviously the first one to go. You know, I don't have any reserves. Been gnawing off my pinky. Right?
And that's why I said a week.
So 6 to 8 weeks, right?
I got plenty.
Now listen, water.
3 days.
How long can you go without water?
3 days. Not very many.
3 to 5 days, right? Depending on what you're doing. You stuck in a desert, you lost, 3 days. You stuck at home in the air conditioning, 5 days maybe. You got bad kidneys, you know, it all kind of depends, but 3 to 5 days. So between food or water, which one's more important to you?
Water.
I promise you it's water. But people don't say that, do they? Like, no one, like, they always say stuff like this. I'm starving to death. I'm starving. Are you starving? No. So you can't hang out with people like that anymore. First of all, it's not true. Secondly, it's exaggerated. Now, listen to me very closely. People don't starve to death in America. Is that true?
True. Yes.
Now, people go hungry. Don't get me wrong. There are people go hungry. Lord knows I was one of them, right? People go hungry. Like, there are some kids that are so poor that after, when they're left from school on Friday,
No meals.
a lot of times they don't get meals Saturday, Sunday, until breakfast on Monday. Now, that's a shame, but they didn't starve to death. Okay? You're not going to starve to death in America. And besides, you can go to 6 to 8 weeks without food, but you only can go 3 to 5 days without water. Does that make sense? So water is much more important. So we have to change this dialogue in our head that says, I'm a hydration machine. I'm not an eating machine. Right? You can't keep saying, oh, I'm a bottomless pit. I can eat forever. No. You gotta say, I drink, drink, drink. I love my water, love my water, love my water. I sip, 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 sip. Does that make sense? Now, question. Air. How long can you hold your breath for on average?
2 minutes.
2 minutes? 1 minute? If you got bad COPD, you got oxygen dependency, can you even make it 30 seconds? No. So, you know, some deep sea divers, pearl divers, might maybe go 8 minutes. But really, it's 2 to 3 minutes. Is that right?
Yeah.
So here's the question for you. If your pimp is holding your head in the toilet, how long can you last for?
Depends on how much you're
2 to 3 minutes. Now listen, I'm not judging, right? I'm not judging. Some people, some people got to do that. That's fine. I'm not judging. But it's not bad enough that you're a prostitute. But now you have to mouth off to your pimp and make him mad, and now he's holding your head in the toilet. Now you're really messed up. Now your life is really messed up. Does that make sense? And he's gonna like hold your head up, be like, "Where's my money?" So how often does he do that? But if he really wants to end your life, he's gonna hold your head in the toilet. How long can you last for? 2 minutes, maybe.
It depends on how much you're exhaling.
2 minutes, right? So, of all of this stuff, food, water, or air, which one's the most important?
Air.
This is the important thing. But we never think about that, do we? We never think about that. I am the pimp. Right? So we never think about protecting our atmosphere, our trees. We never think about, you know, our allergies and our air quality. We never think about hiking to improve our lung condition, right? We never take care of our asthma, right? You'd be surprised. So, of these 2 things, you got to really work on that breathing, that incentive spirometry. You got to walk, and you got to change your mode to sipping machine, hydration machine. Make sense? Y'all have a good talk? Is that all right?
Yes.
Okay, y'all want to do one more?
Yes.
Okay.